So right now I'll be demonstrating how to do a simple wound dressing change. So the first thing I'll be doing will be to check the doctor's order, verify that it will be done on the right patient, and I'll be gathering my supplies. So the first thing I'll be needing will be a sterile package of dressing tray. I'll check the contents of the package, making sure that it's not expired. And if there are any necessary supplies that I need, I'll grab it from the supplier room. Since this is a simple wound dressing and a no-touch dressing change, I won't be needing a set of sterile gloves. I'll just need 2 clean gloves, some tapes, a bottle of sterile normal saline, 4x4 sponge or gauze for changing, and a couple more 2x2 gauze for cleaning. Right, so before I enter the patient's room, I'll do my hand hygiene. Hi, Mrs. Smith. My name is Fan. I'll be your student nurse for today, and I'll be changing your wound dressing. I just need you to verify your first and last name and your date of birth. Alright, so once I verify the patient's name and date of birth, I'll start to explain the procedure further. So Mrs. Smith, I'll be removing your current dressing. I'll be cleaning it and then I'll put on some new dressing. Do you need some pain medicines or analgesics before we start? Or do you want to empty your bladder before we start? And once I've confirmed that the patient doesn't need analgesics, or if she's okay and doesn't need to go to the bathroom, we'll start the procedure. So I'll maintain privacy by drawing the curtains and draping the patient, making sure to expose only the body part that we need. So I'll prepare the sterile field. So I'll open the package. I'll make sure to grab the outer edges of the package to maintain sterility. So I'll arrange the sterile field according to how I need to use it. So I'll get the drape, grab it, and drop it onto this clean field. So I'll arrange the supplies in the dressing or the sterile field. And I'll place the forceps on the edge of the drape, making sure that the part of the forceps that I've already touched remains outside of the sterile field. So at this point, all the things that I've placed here is already considered as clean. So I'll open the trash bag. And using some tapes, I'll secure it at the edge of the bed so it's easy for me to dispose any soil dressing. I will open the drape and place it on top of the patient in order to extend the clean field. I'll wear my gloves. And I'll open the sterile water, making sure that when I put down the cap, that the lid should be facing up. I lip the sterile water bottle and put some sterile water on the tray. And then I'll step back and recap the sterile water. So since my sterile area is now prepared, I'll now remove the dressing on the patient's wound. Since I'll be in contact with possible blood and drainage, I'll be keeping my gloves on. I'm releasing the tape around the wound. And using the forceps, I'll open the dressing. And I'll take a moment to assess the dressing for any drainage, the color, the amount, if there's any foul odor, I'll take note of that, and then I'll dispose it off in the trash bin. And then also dispose of this used forceps and change my gloves. And I'll assess the wound area as well for any drainage, blood, if there's any, the amount that's draining from the wound, any odor, and also assessing the perimeter of the wound as well. Okay, so at this point, it seems that I have enough 2x2 gauze to clean the area, so I won't be opening any package. But just in case I need to open a sterile package, I'll be opening it from the top, making sure not to make any contact in the package. Place it down and drop, and then stand back and dispose of the package. So I have done another hand hygiene and changed my gloves to clean gloves, and so I'll be grabbing the 2 forceps, pick up some 2x2 gauze, and dip it in saline water and wringing out any excess so it doesn't drip. So I'll be cleaning the wound from top to bottom, clean to dirty. So it'll be from top to bottom and then dispose. Top to bottom and dispose. And so at this point, I'll be drying the wound with dry gauze. Following the same principle of top to bottom and clean to dirty. So I'll be picking up enough amount of 4x4 and put it on the wound that we have cleaned. I'll remove my gloves so it's easier to put on tape. Do my hand hygiene. And tape the dressing secure. And at this point, I'll be cleaning the area of the patient, drape the patient and put her on a comfortable position. Ask if she needs anything else before I leave. Assist the patient if she wants to go to the washroom. Keep the call bell in reach and maintain her privacy. And I'll also document the wound dressing change procedure, taking note of the wound and the dressing for amount of drainage, for color, and for any odor present, and whether the patient tolerated the procedure well.